Good afternoon. Uh, is anybody uh, has seen ever or meet from his family, from his neighbors, from his classmates, from his relatives, someone who someone has a mental disorder, schizophrenia? Well, I do. 2 years ago, I have my young cousin in California, and when he started, he was confusing, fighting. No one understand what he has. He was that time 18, 17, I have 18, and family was disoriented. They don't know what happened to him. The father and mother was so sad, but the sister and brother was supporting him. They was agreeing with him and trying to calm down him because they don't know what happened to him. They never know he was sick there. And one day, even I was talking to him. They sent me. They said, "Okay, try if he respect you because he don't listen us for everything. He don't want to go to school. He don't want to go work. He don't want to do anything. Just the fighting, stay at home, watching TV a little bit, a game, and even though he's not still happy, nighttime he never sleep. Then my aunt asked me if he respect you because he don't listen us. Try. Then I talked to him, but he never got it. He has this, fantasy stuff, his brain, and he changed the story. Anyways, I don't want to go deep. Then again, he increased, his sickness was increasing, and he become violent, and he fight with his elder brother. One day, he broke the nose, like, hit his face. The mom don't know what to do, and they call the police because they don't have choice. Imagine somebody who from outside, they don't even speak English well, but the kid was speaking, and the mother was terrified, don't know what to do, don't know how to deal with the police, but the police was nice and take him, and he was speaking good English, take to me to the police station. Right away when they saw, they understood he has some issue. Then because they put him somewhere and he never sit down, and they tell him something, he never listen. And the mom and dad, they were, stayed there, but they were not with him. They don't allow to contact him. Okay, the police, they call it doctors. They understood he has some people, they have experience. So they get it, maybe he has some mental issue. And they call some doctors, and the doctor come in, and they examine it. After they examine it, it revealed that he was sick, and they took to the hospital to treat. And after that, I hear the family has schizophrenia. But after 2 years right now, it's okay. But that day, I start thinking, if you don't know what is schizophrenia exactly, it's a mental disorder that affects your things, your way you see your vision, in the world, whatever you want to see, the way you acting, it affects all your personality. Then you cannot be normal person. Okay. The reason why I chose this topic because I was curious how he get this, because I never hear from my family, and how the was the causes, was the symptoms, and what's the treatment, what's the best way. He took a medication, but I was still curious. I searched it, long research. I found that 3 conclusions, and I would like to share with you a little bit from symptoms and the causes, symptoms, and the treatment. Let's start first with the causes. The causes is not a really, it's like unknown. No one really know how that happened, how people, affect. They don't know the researchers, but they get this conclusion. They say it might affect it from the environmental issues and from gene. If you have somebody who developed, the early from your family. Okay, let's talk first the genes. Your gene is if you have someone in your family that had history for schizophrenia, you might have, in your long life, somewhere in your life to develop. So but it's not, it doesn't mean still you will have, but this is a chance. The second one is if you have if you have identical twins which have same gene you have and have these signals, and in the past or whatever the present, you might have risk to develop because you have the same gene and you are twins identical. But if the risk is still, it's not high, it's not too low, but it's in the middle, 40, 50. Okay, that's the gene. Let's talk about the environmental. Environmental is first during the pregnancy or maternal pregnancy. If the mothers meet this condition, malnutrition, during the pregnancy, if the mother meet this condition, right, malnutrition, difficulty birth delivery, and bleeding, exposure of the viruses in the place she meeting, or she making the baby, or already if she been while she was pregnant, all this accumulation, it will affect the baby, because the baby during that time, this period, pregnancy, delivery, right after delivery, is sensitive, according to the researchers, is sensitive time for, it's a sensitive time that the brain develops. So in this period, if you have this problem, you might, have schizophrenia for your life, but you might not have either. But that's one case. That's environmental. The other case from environmental is the teenagers, early age, when they go into the adult, early whatever. This period, they have difficult. They might they might meet abuses. They might meet struggle in life to settle yourself. Or what we call stressful life. So this person might develop too, but the chance still is not 100%. The third one for the environmental is the people who use the drugs, especially marijuana. Marijuana is people who use long time, they have chance to develop. Okay, this is environmental. So now I talk about the causes. I would like to talk about symptoms. Yeah, the lady was I forgot. Go ahead. Yeah. This if you make it bigger a little bit, the symptoms are a little wider. Yeah. Okay. The symptom is the first symptom common for the schizophrenia is the hallucination, which is hearing voices, what you call daydreams, what you call false imagination, a lot of things. All this you see here, we are those voices. This is voices. Fred, you told me another voices. This is hallucination. Now, other one is elephant under me. This is which is a fake. Imagination. They were following me, which same one still. This is all is for the hallucination. But I have another one. The second one is hostility and suspicious. Okay, hostility and suspicious, since this person already have this voice is coming in his mind, and it's not a stable person, and have a fake imagination or fake beliefs. It doesn't trust anybody. So it's hostile to anyone, or it looks suspicious, or like when you look or talk to him, like my cousin, he fight with his brother because the brother was trying to explain something, but he was thinking, oh, you look at me because I look like that, because I do this, just didn't make myself. Okay, this is one. The third one is social withdrawal. When that person gets this stage, he don't go to school, don't have friends, don't go work, no even friend with his family. So this is a total, what you call social withdrawal. Don't have anything, just Even the doctor, they never agree with. Okay, now we go treatment. I done that with the symptoms. I go the treatment. Okay, the treatment. Since this schizophrenia causes not really knowing well, the doctors they just treat the patient to eliminate the symptom they have. Either they have this agitated hallucination, and also the good medication. Yeah. If the doctors, they all have a one common in United States, most according to the NIH, which is Institute National Health in United States. This is the only medication they give it. All this is 4 type of medications. The first 2 is tablets. The the first 2 is tablets. The second one is a gel, look like a tablet too. The third one is a shot that patient get twice a month or one, depending on the condition they are, or one time. So there's beside the medication, there is another doctor who disagree. Another side of the world, which you will be honest, or disagree that medication and like to have this opinion. They research it, and their opinion is patient has to see a psychology doctor or counseling. They don't need medication. One of the doctor, his name is Tim Carlton. He stated his article. What do you call schizophrenia without medication? Article name. He stated that patient don't need medication. Need just the counseling. Need just to understand well. Need to give personality, like don't give like how I say. Don't give like a them like a trash. That's what he really. I don't want to say this word, but you have to feel this person like you do. So talk to them, understand what they feel, understand why they get what pushed them. Then and he say it's a lot better the medication, but I have a video to share with you. You have time a bit. Yeah, this is the video for the counseling. It's not medication. If you fight a little bit, it's kind of low. Voice, yeah.
I worked with her for a while, and at one point, she was living with her parents, and she wanted me to see a mother who was pushing her to come in because she had various things to tell me. So what I did is I told my patient I would see her mother for half a session, and then I would see her and we would talk about it. The mother came in, and she was one of the most obnoxious, horrific women I have ever met. I contained myself, I retained my composure, I had a discussion with her, I was polite and nice to her. When her part of the session was over, I escorted her out, thanked her for coming. And then I sat down with my patient, and I said to her, look, I have to be honest with you. There were several times while I was talking to your mother that I felt like wrapping my fingers around her throat and squeezing till her eyeballs popped. At that point, my patient looked at me startled, and she said, oh my God, I know what the voice is. It's my own voice, and it's telling me to kill my mother. And I looked at her and said, I can understand that. Well, what happened after that is her command hallucinations went away. I did not plan that. I did not understand before I said what I said, what the nature of her command hallucinations were or where they came from. But once that happened, it was obvious. What she was doing is she was experiencing horrific murderous thoughts toward her mother. And she wasn't able to accept them. So what she did is she projected them outside of her, And those thoughts became a voice telling her what to do. Therefore, she wasn't responsible for it. She's been voice-free now for about a year, not on any medication. Prior to that, before she came to me, she was on 3 different kinds of medication. She had read about the medications, and she really didn't want to be on medication. But every time she tried to come off, she would wind up back in the hospital. After she saw me, she came off the medication over a period of 6 months. Several times she started to feel symptoms, and the covering physician would raise the medication slightly, leave it at that for a while, and then we would start to decrease again. Again, she's medication-free, she's hallucination-free, and she's functioning.
Yeah. Final question was, they asking you, yeah,
That's past.
yes, fast enough.
Yeah, it's like past a minute, so we should just.
Oh, okay, yeah, close. But they ask the question how you treat and what to get. So, okay.
You want this?
In the conclusion, you guys understand why I choose schizophrenia, the horrible mental disorder, because you understand that my young cousin developed it, and I was curious to find out why and how this happened and what caused it. Even though when I look this, I don't see anything related to him, but still, you know, he can get from the, you know, a teen stage maybe, that one early adulthood or whatever, early childhood. And that's, I'm only guessing, but I don't think so. But you understand what's schizophrenia a little bit, not clear maybe. You understand that what causes, you understand the symptoms, you understand the treatment, and I think you have an idea now if you might see someone or if someone telling you what is it. Thank you so much.